it's a very long topic. So I hope you have seen the asynchronous video. So we have divided it into subtopics. So the first, of course, will be your reflexes, and your reflexes will include the receptors, of course, right? And then we have the descending pathways, we have the motor cortex, we have the basal ganglia, and then the cerebellum. Okay, so that's how we are going to discuss motor system for today. We will make it short and sweet as much as possible kasi sobrang haba niya. Okay, so for my introduction, you just have to answer two questions. This is actually these questions are actually a review for you. Ayan. Launch. Yeah. So can you see the questions?
Yes po, Doc.
Yes. So please answer this ilan ba to? Two questions lang. And then we will discuss it. Sige. Ayan, may mga nag-chat pala. Good morning. Yes, good morning. Okay. Those are only two questions. So, sandaling-sandali lang yan. Okay, so for the latecomers, we have two poll questions. Dalawa lang. If you have read the reading material, you should be able to answer this. May mga anak, parang wala sa loob niyo yung pagsagot, ano? Okay, so I'll end the poll. Teka, mag-a-admit lang ako. And then I'll end it. Okay, let's share the results. Okay, so these are the results. Some of you answered motor unit. Okay, we will see later what the answer is. But actually, for question number 1, this is just a review for you. So again, if you have seen the if you have viewed the asynchronous lecture, it says there that you have to review some terms that you have learned from your muscle physiology. Like for example, your motor unit, your neuromuscular junction. Okay, you should review all those. The size principle. Okay, mamaya sabihin natin kung ano yung sagot ha. Pero yung motor unit, mali yan. Okay, and then for number 2, what initiates a deep tendon reflex? We will actually be discussing several concepts here. So we will be reviewing the reflex, the classification of your reflex, the components of your reflex. Okay, review ito, 'di ba? Because in your motor system, what we will be focusing on will be the motor reflexes. Okay, so some answered contraction of extrafusal muscle fibers, So we have to discuss that. Ano yung extrafusal muscle fibers? What are intrafusal muscle fibers? We also have to discuss the alpha-gamma coactivation and then the stimuli for these reflexes. Okay? I'll just be discussing some of the concepts that are yung medyo mahirap intindihin, no? Okay, so I'll stop sharing. Okay. Can you see my slides?
Yes po, Doc.
Okay. So ano lang naman first ano pa lang. So next. Okay, so this is the question. Motor neurons are clustered in columnar spinal nuclei. Most of you answered motor unit. Okay. Ano ba yung motor unit? The answer is actually the motor neuron pool. Okay, it's the answer. But first of all, ano ba yung motor unit? Ano yung innervation ratio? Ano yung neuromuscular junction? Anyone? Anyone who remembers? Wala. O yung lecturer lang ang nakaka. Okay, so this is in the reading material. Okay, so this is your motor neuron pool. Ito siya yung motor neuron pool. Okay, so this is the neurons, set of neurons clustered in a columnar fashion. Okay, so these are called also yung motor nuclei. Okay, so what about your motor unit? The motor unit is composed of the muscle fibers. Okay, the muscle fibers. So ito yung muscle fibers and neuron that innervates those muscle fibers. Okay, hindi niyo ba maalala kung ano yung motor unit? Okay, during muscle physiology we discussed that. And then of course you have the neuromuscular junction. Okay, so in the neuromuscular junction you have specifically the neuron. So in in the motor system, the neuron we are referring to here is the alpha motor neuron. Okay. Now, what's confusing in neurophysiology is that your for example, your alpha motor neuron, it can also be referred to as your lower motor neuron. 'Di ba? Ang daming terms kasi for the same uh structure. Okay, kaya nakakalito. Okay, so later on, we will be referring to this as your alpha motor neuron. Okay, but it can also be referred to as your final common path. So, iba na naman yun, but it also refers to the same thing. Okay, so please remember all this. Okay, so and also by now, you should be able to distinguish between a muscle and a muscle fiber. Okay, the individual muscle fiber. Now, individual muscle fibers are innervated by only one motor neuron. Okay. Now, what about your ano pa yung isang innervation ratio? Okay. So the innervation ratio refers to the number of fibers. It refers to the number of fibers innervated by a motor unit. Therefore, okay, inaral nyo rin to before. Okay, ni-lecture ni Dr. Tan ito. Therefore, innervation ratios can be small, okay, because a motor neuron can innervate only small number of muscle fibers, so around 10, for example, to hundreds, or it can be big or large, wherein a motor neuron can innervate large numbers of muscle fibers. Pag sinabi nating large number of muscle fibers, thousands ito. Okay, thousands. Okay, so those are the choices that you had earlier. So you must be able to remember those. Okay. Now for the next concept check question. What initiates a deep tendon reflex? Okay. Lahat kayo nag-answer. May nag-answer ng A, B, meron pang C, meron ding E. Okay, what's the answer here? Now, what are the concepts that we will be discussing under this question? So as I've said, we'll be discussing the reflex in general, the components of the reflex, which this was introduced to you before. Okay, na-introduce ito when you had your autonomic nervous system. Okay, and then we will be spending some time looking at the classification of your reflexes. Now, why is this important? Now, in the laboratory, yung inyong lab manual, okay, nakita nyo ba yung tabulation doon? You are supposed to classify the reflexes that you performed. Okay, that's why you have to understand what or how reflexes are classified. We will also be discussing the muscle spindle and this alpha gamma coactivation. Okay, so ano ba ang sagot dito? Ang sagot yung stretch. Okay, the stretch of the muscle, of course. Now, that's what you do whenever you perform deep tendon reflexes. Now, what are some examples of your deep tendon reflexes? Before we go into that, punta na tayo dito. The uh, the components of your reflex. Okay, so you have your receptor or your sense organ. Okay, you don't be confused about, we have used the term receptors before, di ba? Saan natin ginamit yan? Anyone? Titingnan ko ngayon chat, baka may sumasagot sa akin. O yun no, may sumagot sa akin. Thank you, thank you. Oo, mga tamang sagot. Okay? So, where did you encounter the term receptor before?
Cell signaling po.
Thank you. Tama, cell signaling, di ba? And those are actually receptor molecules. Di ba? So you have your, for example, you have your acetylcholine receptors, you have your norepinephrine or epinephrine receptors. Those are receptor molecules, and those are found either in the plasma membrane, di ba? Or within the cell. Okay. Now, the receptor we are talking about here is your receptor organ. So, iba yun. Okay, iba ito. What are some examples of receptor organs that you remember from your general senses and special senses? Okay, ano yung mga receptor organs natin doon? Pwede sa chat, pwedeng sumagot. I can see it. Ano mga receptor organs natin doon? Yes, we have our mechanoreceptors. Merkel's disc, yes. Ano pa? So, sa vision, ano ang ating receptor organ? Or sense organ? Or receptor cell? Doon na tayo sa receptor cells. Rods and cones. Yan, photoreceptors. Yes, because rods and cones are photoreceptors. Okay? Now, your receptors also have their classification. So, sinabi dito yung ibang classification. So, check the chat box. May nagsabi ng mechanoreceptors because they are stimulated by mechanical means. Okay? Under this, you have your stretch receptors. Diba? Kasi mechanical yun eh. Okay? And then you have your photoreceptors. Ano pa? You also have your, ano pang ibang classification? What else? Chat. Chemoreceptors, correct. So we have a lot of chemoreceptors in taste and smell, diba? Ano pa? We have nociceptors also, correct. Thermoreceptors. Ay, ang galing, may nakakasagot sa akin. Thank you. May nakakaintindi. Okay, so that's the first component of a reflex. Okay, now the second component, of course, is your afferent neuron. So in your receptor cells, we generate the generator potential. Also ito na naman, iba-iba yung tawag dito eh. Also known as your receptor potential. Now, receptor potentials or generator potentials are local potentials. Okay. So, pero ang alam na alam nyo yung action potential. So where do we generate our action potentials? Now, the action potentials are generated in your afferent neuron. Okay, so you have your generator potentials in the receptors, and then there will be summation of these generator potentials, and then you will be producing your action potentials in your afferent neuron. Okay, so the action potentials are now conducted towards the center. Ito na, so you have the synapse here. Okay, so this is the integrating center. So your integrating center will be in the CNS. And this is where we have our EPSPs and our IPSPs, if you remember. So we have our synaptic potentials. So our synaptic potentials are also local potentials. Okay, so when there is summation of this EPSPs, then you will be producing the next action potentials. But now this will be in the efferent neuron. So the action potentials here will be traveling towards your receptor. Okay, so ano yung 5 components? So you have your receptor cell, and then you have your afferent neuron, also known as your, what's another term for your afferent neuron? Uy, very basic lang yung mga tanong ko, ha. It's also known as your sensory. Good. Okay, your sensory neuron. Then you have the integrating center. The efferent neuron is also known as your motor neuron. Correct. Okay, correct. Okay, and then it goes towards, the action potentials will go towards your effectors. Now, effectors may be in the form of muscles. So, yan. Good. Okay, so pwedeng cardiac muscles, pwedeng smooth muscles, okay? Or pwedeng skeletal muscles. So for our topic now, we have our skeletal muscles as our effectors. Okay? Where did we learn the smooth muscles, the cardiac muscles, and glands as our effectors? Saan nyo na-encounter yun? Anong topic? Which topic in physiology? Yes, meron sa cardio, pulmo, and GIT. Yes. But where were they discussed in general? Ang nag-lecture nito si Dr. Jacinto. Am I correct? Uy, hindi nyo ba naalala yan? Uy, yun. Pero may question mark. ANS po? Ayan. ANS? Muscular. Hindi, ANS, the autonomic nervous system. Okay? So, you should be able to distinguish between your autonomic nervous system and your somatic nervous system. Okay? Nireview rin yan. Nireview ni Dr. Baring yan, diba? Okay, so, next. Ayan yan yung typical reflex that we have. Ito na ngayon, the classification of reflexes. Now, reflexes can be classified as, dun sa question natin, deep tendon reflex, sabi natin, di ba? Now, how can we classify a reflex as being deep? Okay? Deep tendon reflex. Actually, sabi ng iba, misnomer daw yun. Okay? Okay, so by the location of your receptor, you can classify your reflexes as being superficial or deep. Okay, and also by development, pwedeng innate, pwedeng acquired. Okay, they can also be classified as somatic or visceral. Okay, so all those reflexes that you have learned under your cardiac, your pulmonary, and ano pa ba? Gastrointestinal, ang daming reflexes doon, di ba? Those are autonomic reflexes or visceral reflexes. Okay, because their effectors are smooth muscles, their effectors are cardiac muscles. But in your skeletal muscles, but if your skeletal muscles are the effectors, then those are somatic reflexes. And also, you can classify your reflexes depending on the number of synapse. Okay, so it can be classified as a monosynaptic reflex or a polysynaptic reflex. Most of the reflexes that we have are polysynaptic. Okay, and then we have, of course, the processing site. So if the processing site is within the spinal cord, spinal reflexes, yeah. So if it's within the cranial nerve, so it's called your cranial reflexes. Okay, so dun sa manual ha, merong table dyan, ika-classify nyo yung inyong reflexes. Okay, let's go to the receptors. So these are proprioceptors. Okay, ano ba yung proprioceptors? Yung mechanoreceptors madali. Yung inyong chemoreceptors madali. But what are proprioceptors? What information do we get from proprioceptors? Chat, position sense, yes. Position and movement, equilibrium, position and balance, yes. Yes. Force, yes. Okay, good, very good. Okay, so these are proprioceptors. You also have joint receptors, wala dito. Okay. Now, dun sa choices natin kanina, meron nakalagay doon, contraction of extrafusal muscle fibers. And then another choice is contraction of intrafusal muscle fibers. Ano ba itong mga to? Okay. Now, what you have learned in muscle physiology is about production of force within the muscle. Okay, so you talked about extrafusal muscle fibers in your skeletal muscles. Now, what are intrafusal muscle fibers? Intrafusal muscle fibers compose your muscle spindle. Nasaan ba yung muscle spindle? Now, the muscle spindle is within the belly of your extrafusal muscle fibers. As you can see in the diagram, intrafusal muscle fibers that compose the muscle spindle are parallel, arranged parallel to your extrafusal muscle fibers. So that if your extrafusal muscle fibers are stretched, okay, your muscle spindles are also stretched. Okay, that's actually the stimulus for your muscle spindle, the stretch of the muscle. Kaya ang sagot dun sa ang sagot dun sa concept check question natin kanina, stretch of the muscle. Okay. The Golgi tendon organs are also here. They are found within the tendons, and they are arranged in series, okay, within the tendon. Okay, so this is what you have in the reading material. Okay, so we have different types of fibers within your muscle spindle. So we have the nuclear chain fibers. Nuclear chain fibers are elongated. Okay, they are elongated. And then the other type is your nuclear bag fibers. The nuclear bag fibers are divided into two. You have the static and the dynamic bag fibers. You see the difference, di ba? Yung bag fibers have this enlargement in the middle, okay, with the nuclei. And then, ano pang mga interesting dito? Okay, so we have these neurons. We have these neurons, and these neurons are your 1A, your 2, and your gamma. Now, it's very important to take note of where the termination of these neurons are, because their functions are affected by these terminations. Okay, so the termination of your 1A is known as your annulospiral endings. Okay. Now, where do they end? Okay. Dito sa nuclear bag fibers, and both dynamic and static. And then they also end in the nuclear chain fibers. Okay. Because of that, they are able to determine length and velocity of contraction. So the length of the muscle and the velocity of velocity of the movement of the muscle is determined by this annulospiral endings. Now we have type 2. Okay, naalala niyo ba itong mga neurons na to, itong mga nerves na ito? 'Di ba? Merong 1A, may type 2. Notice that they end only in the static nuclear bag fiber and in the nuclear chain fiber. So they're called your flower spray endings, and they determine only the length. What about this gamma? Okay, gamma, ayun no, itong gamma na to. It terminates on the dun sa ends, okay, dun sa polar ends. Okay, now why is it important to take note of this? Okay, the polar ends of your fibers of this nuclear bag and your nuclear chain fibers are composed of contractile muscles. Okay, so the polar ends are able to contract, so that if your gamma motor neurons innervate the polar regions, it means that these ends are able to contract. Why is that important? That's important for the function which we will be discussing later, yung alpha gamma co-activation. Okay? So yung yung gitna, yung equatorial regions of this intrafusal muscle fibers are non-contractile. They are non-contractile. Okay? So let's take a look at okay? This is from Guyton, and you can see the classification of your neurons. Now, neurons, if you remember during noong unang panahon pa, no? If you remember during your first lectures, they are classified as myelinated or unmyelinated. Okay. They are also classified according to their diameter. They are also classified according to their conduction velocity. Okay. So, di ba sabi natin, pag myelinated, faster conduction velocity. When the diameter is bigger, conduction velocity is faster also. Okay, so nasaan ang 1 at 1A natin? Ito nandito. Sensory nerve classification 1. Can you see my cursor? Turo ako ng turo dito, baka hindi nyo nakikita. You can see?
Yes, Doc.
Okay, thank you. And then we have this 1A. Okay. And then we have this 1B. Nasaan ngayon yung gamma natin? Gamma is here. Okay, ito yung gamma. Okay, gamma, ano pa ba? Alpha. Okay, we also mentioned about the alpha motor neuron earlier. Alpha motor neurons, gamma, and your, ano pa ba? Yun. Okay, 1A, 1B. Okay, ito na ngayon yung alpha gamma co-activation. What is this about? The alpha gamma co-activation makes sure that your muscle spindles are always responsive. Okay? Responsive sila dapat even if your muscles are shortened. Okay? They are most responsive, of course, if the muscles are lengthened. Diba? So here, we have a schematic drawing wherein the muscles are at rest. Okay? So what happens when the muscle is stretched? Okay? When the muscle is stretched, the muscle spindle is also stretched. And as you can see, there is an increase in the generation of impulses when the muscle is stretched. So the muscle spindle will now be increasing its impulses. Okay, so that it now sends through this, impulses are sent towards the center so that you now know the length of your muscle. Okay, so what's the reaction? In the basic reflex, okay, the reaction will be contraction of the muscle. Okay, now when the muscles contract, they shorten, di ba? Ano nyo yan eh, natutunan nyo sa muscle physiology, they will shorten. As we can see in this diagram. They are shortened. So what happens to ito, tingnan nyo yung nangyari dun sa intrafusal muscle fibers. Okay, hindi na siya lengthen. Okay, so when this happens, it's not able to generate impulses. So parang hindi na siya effective, ano? Okay? But because of the gamma efferents that you have in your muscle spindle, and as you have said, the gamma efferents will be innervating the polar ends of your muscle fibers, which are contractile. Kita nyo ba yung drawing? Contractile yan eh. So upon the discharge of impulses through your gamma efferents, the polar ends will contract and it will make the intrafusal muscle fibers stretch again. Okay? Kita nyo? So that when there is contraction of your extrafusal muscle fibers because of the innervation of your alpha motor neurons, there will now be contraction also of your muscle spindles because of the discharge of impulses from your gamma effects. That's why we call this the alpha gamma co-activation. Okay, so yun lang yung medyo mahirap intindihin dito. Okay? What else? What else? Okay, so this is what you have in the reading material. Okay, so this was demonstrated so that this was illustrated. Okay, diba pag clinic niyo yung play, okay, a picture will be put on this tray, so that's the stimulus. Okay, it will cause now the lengthening, okay, the lengthening of your muscle, which will be detected by your muscle spindle. And because of that, impulses will be sent through your afferent neurons going towards the center, the spinal cord, and then it will be stimulating your alpha motor neurons, causing your muscles to contract, so that the tray with the picture will not fall. Okay, so that the arm will be able to carry the weight of the picture. Okay, yun yung magandang example. Okay, and then, okay, so you also have this reflexes, this withdrawal or flexion reflex. These are the components. Yan. Okay, hindi na natin masyadong i-discuss to. Medyo elementary to. Okay, so the pinaka-common na example dito, di ba, will be this hot object. Okay? So, if in my question, I ask about, for example, withdrawal reflex, okay, the stimuli will not be the stretch of the muscle. Ang stimulus dito will, of course, be itong pain or noxious stimulus. Okay, and then we also have this flexion and cross extensor reflexes. Okay, and then this is what you did in the lab. Okay, so these are examples of deep tendon reflexes, or DTRs. This is your patellar reflex, and this is your ankle jerk. So in the asynchronous video, I ask you to name some of the receptors. Okay, so ano tayo ulit? Paul tayo. Pauling. Okay, so we go back to, kasi alam ko medyo inaantok na kayo. So, Paul tayo ulit. Yun lang, hindi ko mahanap. La la la. Wait lang. And then ko mahanap. while I am doing this, hindi, ayan na, nahanap ko na eh. Part 2 na tayo, part 2. There are only 3 questions here. Can you see the poll questions?
Yes po, Doc.
Okay, yes. There are 3 questions here, only 3. So I'll give you 3 minutes. Okay, I'll be ending the poll now. It's already 8:55. And share results. Okay, so in number 1, most of you answered lateral corticospinal tract. Okay, so we are now in the descending pathways. If in your general senses you had ascending pathways, here we have descending pathways. Okay, so in number 2, we have most of you answered vestibulospinal tract. And then in number 3, okay, most of you answered tectospinal tract. Okay, so I'll stop sharing. Okay, so maraming pumasa sa 1 and 2. Maraming bumagsak sa number 3. Let's stop sharing. Okay, so let's go back to let's discuss the questions. No? Control of the fingers while doing a selfie is most likely mediated by the lateral corticospine. Bakit nga ba bakit nga ba lateral corticospinal tract? Now, this is the most well-studied tract actually. Okay? And you have classifications of your descending pathways. Okay? So yung classifications are medyo nakakalito rin, ano? So they can be classified as lateral pathways. I gave you a table that you should fill out, and there are two classifications nakalagay doon, lateral pathways and medial pathways. Now, why do we classify lateral pathways as lateral? Now, that's because, pakita ko na yung susunod na slide. Okay. Now, that's because they terminate, tingnan natin yung lateral. They terminate in the lateral portion of the ventral horn of the spinal cord. That's why they are classified as lateral pathways. Now, what about your medial pathways or your ventral pathways? Or some books will classify it as ventromedial pathways. Okay, sabi ko ngayon yung nakakalito sa neurofish, ang daming terms na pare-pareho pa lang. Okay, they terminate in the ventromedial portion of your of the spinal cord. Okay. Okay, now your corticospinal tract, specifically your lateral corticospinal tract, kasi may anterior, di ba? Now, some books will also name that as ventral corticospinal tract. Okay. Now, your lateral corticospinal tract has this. Okay, it is in the reading that I gave you, it was stated there that it is important for the fine control of the digits of the hands. Okay, that's why in the question, control of the fingers while doing selfie, or for example, if you're texting, okay, the most likely pathway that mediates this action will of course be your lateral corticospinal tract. Okay, so paano ba yung pathway ng lateral corticospinal tract? Wait lang. Let's look at the classification ulit. Okay. So corticospinal tracts can be classified as lateral or ventral or anterior. Okay, they both come from the same source in the cerebral cortex. Okay, we will see later on the pathway of your corticospinal tract. And then we have this ventromedial pathways. Now, these ventromedial pathways are also classified as brainstem pathways. And these are your reticulospinal, tectospinal, vestibulospinal, and rubrospinal tracts. Okay, so you can see that they terminate in the medial portion of the spinal cord, of the anterior portion of your spinal cord. They all influence lower motor neurons. Okay, so itong mga neurons na ito, they are referred to as upper motor neurons. Okay, and then when they terminate in the spinal cord, they will form a synapse with your lower motor neurons, which were referred to earlier also as your alpha motor neurons, which can also be referred to as your final common path. Okay, pare-pareho yun, pare-pareho yun. Okay, so ayan, ventromedial pathways, brainstem pathways. Next, okay, let's take a look at the corticospinal tracts. So your corticospinal tract will be it comes from different sources. Okay, 1/3 of this will come from your will come from this M1. Again, I told you to identify this diagram in your asynchronous. Okay, so 1/3 comes from this M1, and then some will come from your SMA, PMA, and then also from your sensory association area. Okay, so this is the pathway of your corticospinal tract. So from those areas in the cortex, it will go down. Okay, it will go down through the through your corona radiata, and then through your internal capsule, and then down to your midbrain, and then to your pons. Okay, until it reaches this the medulla. Now in the medulla there is this very important um crossing over. Okay, here it will decussate. So decussation means crossing over. So it will cross over to the other side as it continues to go down. Now, as it continues to go down, we also have this separation of your ventral corticospinal tract. Okay, now how much of this pathway will give rise to your lateral corticospinal tract? Around 85%. Okay, 85 to 90%. Okay, now the 10% remaining will be your anterior corticospinal tract. Okay, nakita nyo magkaiba sila ng termination. And then they will be, through this, they will be influencing your lower motor neurones. Okay? So, ito yung termination nila. Okay, so the anterior corticospinal tract will be terminating in the in the medial portion. So they will be involved in control of movement of the axial muscles. Axial, nasa gitna. Okay, axial muscles, important for balance. Now, your lateral corticospinal tract, as we have said a while ago, will be controlling distal muscles, specifically the fingers. Okay, so that, hindi dinig niyo ba yung pumupukpok? Sorry may construction sa tabi namin. Okay, so the lateral corticospinal tract will be involved in skilled movements, while the anterior corticospinal tract will be involved in posture and balance. So, anong nakikita nyo dito? Hindi siya nagsiselfie ha. Okay, the person is putting a bulb, pero mukhang nagsiselfie, diba? While putting the bulb, okay, light bulb, you will be, while putting the light bulb, it's very important that you also maintain your balance. So that's through your anterior corticospinal. So all this descending pathways will have to work together. Second question for this part. While doing a selfie, control of posture while head tilts, di ba? Pag nasi-selfie, gumaganyan-ganyan pa kayo. Okay, di ba? And then the body moves also. Okay, and this will be mediated by, anong answer dito? Most of you answered it correctly. Okay, maraming tama dito. Okay, 50% ay tumama. And the answer is your vestibulospinal tract. Okay, vestibulo. Okay, vestibulo. It means to say that it comes from your vestibular nuclei, 'di ba? Saan galing yung vestibular nuclei? Saan galing? Saan connected yung vestibular nuclei? Siyempre sa vestibular apparatus, 'di ba? Teka, hindi ko nakikita ang chat. 'Di ba? Sa vestibular apparatus. Okay? And the vestibular apparatus is for, what is it for? Nawala yung aking chat. What is it for? It's for, yun, balance, equilibrium. Yes. Tatakpan pala. Correct. Balance and equilibrium. Okay, which means to say, diba? Para sa balance ito. Okay, so these are your vestibulospinal tracts. It's divided into two. So you have your lateral, the lateral vestibulospinal tract. So the lateral vestibulospinal tract will be innervating the extensors, the anti-gravity muscles, okay, in the upper and the lower extremities. What about your medial vestibulospinal tract? The medial vestibulospinal tract will be innervating muscles of the neck and back, specifically the upper back. Okay, so together, your lateral vestibulospinal tract and your medial vestibulospinal tract will have this balance in the control of balance. Will have this regulation, okay, in the control of balance. And they are specifically stimulated by head movements. Okay? Because yun nga, nanggagaling sa ano yan, vestibular apparatus. Okay, so the next question has something to do with, yan, this has something to do with, ano ba ito? Made you jump with joy. So this is something to do with emotion, ano? Parang hindi ano to. It's not mentioned in the reading material that I gave you. Kaya lang it's very interesting to know this because most of our actions, most of the voluntary movements that we do, maski yung involuntary movements actually, di ba pagka malungkot ka medyo, ang itsura mo medyo malungkot din, di ba? So emotions influence the way we move. Okay, so when you receive this good news that you passed physiology, it made you jump with joy. Okay, dito maraming hindi nakasagot. Okay, most of you answered tectospinal tract. Tectospinal tract has something to do with coordination of your head and eye movement. Tecto, it comes from the tectum, okay, from the superior colliculus. The superior colliculus has something to do with vision. Okay, so this has something to do with the eyes. So ang answer dito, ang answer is your reticulospinal tract. Okay, so this is your reticulospinal tract. As the name implies, you have your pontine and your medullary reticular formation. Ito haba ng reticular formation. Okay, and it is believed that it has something to do also with the control of breathing and the emotional motor system. Okay, it is believed that it is influenced by the limbic system. Okay, and you have this neuronal networks with this neurotransmitters. That's why your emotions are able to influence our actions. So this is the table that I told you to fill out. Okay, please fill this out because syempre naman I will ask questions as you feel based on how you fill out this table. Ayun, nakita niyo yung lateral pathways. So you have your lateral corticospinal tract. Sorry. You have your lateral corticospinal tract, your rubrospinal tract, and your corticobulbar. Medial pathways are vestibulospinal tract, reticulospinal, tectospinal, and your ventral corticospinal tract. Fill this out, please. And then I also told you to identify this part, different parts of the motor cortex. Okay, so you have A, B, C, D, E. So these different parts of the motor cortex will have different functions. Okay, so you not only have the primary motor cortex as part of the motor cortex as far as movement is concerned, you also have other parts like your premotor, your supplementary motor, and your sensory association cortex. Please answer this. Itong mga to are from the reading material. Okay, from the assigned material that I gave you. Answer this. Bibigay ko to sa exam. Okay, so aside from those, eto pa, please answer this also. Okay, you can find the answers in the reading material that I gave you. Okay, this is very important clinically. So, before you will be able to answer those, kailangan naintindihan nyo muna kung ano yung lower motor neuron, kung ano yung upper motor neuron. Okay, and yeah. Differentiate the two as to the muscles affected, muscle atrophy, weakness, fasciculation, fibrillation. What are those? Muscle tone, reflexes, paralysis, spasticity, and Babinski sign. Okay, you will find the answers to this in the reading, assigned reading material. And then, okay, now for the third poll, discuss muna natin ito bago tayo magpunta dun sa third poll. So titingnan ko, dito naman, I will see if you will be able to answer the questions after listening to this. Okay, so this is a coronal section of your basal ganglia. Okay, some books say this is a misnomer because this should be named daw basal nuclei. Kasi nasa ano siya eh. I'm sorry. It's within the CNS kaya daw dapat basal nuclei. So it's composed of your caudate, your putamen, your globus pallidus. Okay, you also have your subthalamus and your substantia nigra. Now, these are some generalizations that you should remember. The neostriatum, okay, the neostriatum is composed of the caudate and the putamen. They receive almost all afferent input to the basal ganglia. Okay? Saan ba nanggagaling yung afferent into the basal ganglia? Okay, it comes from your cortex. Okay, what about the efferent connections? The efferent connections are through the thalamus. Okay, so the action potentials will be sent out of the basal ganglia through the thalamus. Okay, now what about your substantia nigra? Okay, specifically the substantia nigra compacta. Okay, this will send dopaminergic projections to the striatum. Dopaminergic. Okay, so ang neurotransmitter natin dito is dopamine. Okay, so let's take a look at the connections. Ayan, ito. What are these? These are actually the parts of the cerebral cortex that will be sending afferent impulses to your basal ganglia. Yan, no? Itong mga to, they will be sending afferent impulses to the basal ganglia. So in the basal ganglia, we'll have the direct and the indirect pathways. So ito yung direct pathway. So ito yung indirect pathway. Okay. So the objective, when you study this, please study I gave you this in the asynchronous. Please study the neurotransmitters involved. Okay, so from the neostriatum, you have a direct path going towards this this part of the globus pallidus, okay, the globus pallidus internal. Okay, take a look at the signs also. Syempre pagka negative, inhibitory 'yon. So pag positive, excitatory 'yon. Okay, so look at this. Double negative siya, oh. Double negative. What does that mean? Diba? So ito, negative, negative, positive, and then negative, positive. What does that mean? Okay, anong magiging output? Hindi ko na iisa-isahin yun, ha? Aralin nyo dun sa ano. In the reading material, there is also meron pang equation dun eh. Diba? Meron pang equation. Okay, so there is double negative. Okay, so these are the two different pathways, direct and indirect. Okay, but as you can see here, itong direct na to will favor movement, the indirect will oppose movement. Okay, how will that happen? You should understand the signs. Negative, negative, positive. Okay. What about the nigrostriatal pathway? So aside from the direct and the indirect pathway, we have the nigrostriatal pathway. The substantia nigra pars compacta will be producing a dopamine. Nigra, so it's dark. Kaya nigra, substantia nigra. So you have this nigrostriatal pathway. So your dopamine through your D1 receptors will have excitatory effects on the direct pathway, and through the D2 receptors, it will have inhibitory effects on the indirect pathway. Yeah, so this is the normal. I gave this to you in the asynchronous. Sabi ko sa inyo, 'di ba? Spot the differences in the two diagrams. Okay? Tingnan niyo yung mga differences dito. Look at for example, ano ba nangyari dito? Okay. So, ayun yung direct pathway nabura. Okay? Nabura yung direct pathway. And then nabura din itong dopamine, itong nigrostriatal pathway mediated by dopamine, nawala siya. Okay? And then this sign became bigger. This sign became smaller. This sign became bigger, and this became smaller. Ay, ano kaya nangyari doon? Diba? And then, so this is something to do with a hypokinetic disease known as, anong hypokinetic disease ang alam natin? Chatbox. Chatbox kasi nakakatulog na kayo. Hypokinetic disease. Ay, ba't walang sumasagot sa akin? Ayan, okay. May sumagot na sa akin. Okay. Yes. Yes. Parkinson's. Okay. Uy, dapat alam nyo yun, ha? Kung ano nangyari dun sa mga pathways, kung ano yung na-stimulate, kung ano yung na-inhibit, what neurotransmitters were affected. Ganyan. Okay. Next. This time, syempre kung may hypokinetic, may hyperkinetic. This time, what happened here? Ito nangyari, Look. Okay? So this became bigger. This became smaller. Compare nyo dito. Smaller. Tapos ito, bigger. And then, nabura yung indirect path. And then, this became smaller. This became bigger. Okay? So sobra siyang na-stimulate. So we have a hyperkinetic disease. What hyperkinetic disease do we know? Dun sa assigned reading natin, anong meron? Chat box. Parang ako na yung makakatulog. Chat box. A hyperkinetic disease. Huntington. Very good. Okay. So, Huntington disease. Yan, Diba? Yan, Yan. Yan. Yeah. Okay. When you look at the diagram, you will be able to explain. Okay. So, ito na ngayon yung ating next na poll. Okay? I hope you will be able to answer this after what we have discussed. Okay, kaya lang ayaw mag-appear ng yun, okay. Poll. We are now in part 3. Launch. Tingnan ko nga kung masasagot nyo ito. Binaligtad natin, nag-discuss muna tayo. Okay, may sumasagot pa ba? Okay, let's end the poll. Share results. Okay. I want to look at the brighter side that most of you answered yung tamang sagot, ano? Okay. The not so bright side is merong mga sumagot ng obviously mali, diba? So, doon ako sa brighter side. Okay. So, number 1, let's take a look at number 1. How does the loss of the dopaminergic neurons cause the poverty of movements associated with Parkinson's disease? Okay. When you overstimulate the direct pathway, what happens? In direct pathway, stimulatory yan. So when you overstimulate, lalo siyang, there will be a lot of movements. Okay? Hyperkinetic yan. Understimulation of the indirect pathway, what happens if there is understimulation? Understimulation of the indirect pathway is inhibitory, diba? So if there is understimulation, pwede, diba? Pwedeng magkaroon ng pwedeng magkaroon ng um, poverty of movement, walang inhibition eh. Right? But the best answer is, best answer is loss of nigrostriatal pathway in the basal ganglia, as what we have just discussed. Okay, so through your substantia nigra, okay, due to the decrease in dopamine, there will be loss of the nigrostriatal pathway. Okay, and then in the yung second, mamaya na tong nasa slide. Yung second, what type of drug should this patient be prescribed to alleviate this symptom? Sorry this refers to question number 1. Ayoko nang ulitin kasi. So, question number 1, dopaminergic, loss of dopaminergic neurons. Okay? Yan. But may nag-answer pa rin ng acetylcholinesterase, barbiturates, sympathomimetic. Nandun na yung sagot sa tanong, dopaminergic neurons. So therefore, okay, we will prescribe dopamine precursors. Diba? I'm still looking at the brighter side. 69% yung sumagot. Okay? Now the third, diba, kakasabi ko, substantia gelatinosa? Hindi yan ang sagot. Ang pagpipilian nyo dito, yung dalawang substantia nigra. Okay? So, what did I tell you earlier? Substantia nigra pars compacta. Okay, that's the answer. But, what do I want you to see in this question? Okay? Doon na tayo sa doon na tayo sa doon sa screen share. Okay. You see the underlined terms? Difficulty getting out of his chair and taking a long time to begin walking toward her office. Okay, so that we believe that the basal ganglia has something to do with automaticity. Okay, now these movements are actually automatic for us, for normal people. Ang dali mong tumayo from your chair, ang dali mong lumakad, diba? But to patients with Parkinson's disease, hindi siya madali. Okay, it takes time. Okay, the man walked with a slow shuffling gait. Okay, and then there is this characteristic tremor. Okay, yung pill rolling tremor. Okay, so the patient spoke slowly in a flat tone without blinking. There is increased muscle tone in his arms and legs. Yan o. Ang tawag dito, shuffling gait. So the patient has a bradykinesia. The poverty of movement that we mentioned in the first question. Yun, bradykinesia. Slowness in initiation and execution of movements. There is rigidity, there is tremor. This is resting tremor because for cerebellar disorders, you also have tremors, but it's called intention tremor. I'm just introducing this to you ha. Pagdating nyo ng neurology, pagdating nyo ng sa neuroanatomy, this will also be discussed. So in your neuroscience modules all throughout, second year, third year, clerkship, uulit-ulitin nyo ito. Okay, so there is postural instability and gait disturbance. Okay, so the answers I have already told you. Okay, so ano pang natitira sa atin? Okay, so lastly, we have our cerebellum. Hindi ako nagtatanong ng any questions because we have another lecturer. So if you have any questions, put it in the discussion board in Canvas. Okay, alam ko magkakaroon kayo ng questions pag inaral nyo na to eh. Okay, so this is the structure of your cerebellum. Yay, pag cerebellum na, ibig sabihin patapos na tayo. Okay, it is said that the cerebellum has, ito yung maraming number 3 dito. Okay, maraming number 3. So ano yung mga number 3 dito? 3 lobes. Okay, the anterior lobe, the posterior lobe, and the flocculonodular lobe. Next 3. Okay, yung 3 areas, 3 inputs, 3 three pairs of peduncles to which they are attached. Okay, ano pa? There is also 3 layers of the cortex and 3 outputs through 3 nuclei. Please read all this, okay, in the assigned reading. Okay, basta puro 3 yan sa cerebellum. Functional divisions. Okay, so we have also 3 functional divisions. The spinocerebellum through your vermis and your fastigial nuclei, and the intermediate zone and the interposed nuclei. They coordinate axial muscles and distal muscles. The vestibulocerebellum has something to do, cerebrocerebellum. Okay, so the cerebrocerebellum has something to do with the lateral cerebellum and the dentate nuclei. They are involved in planning and timing of movements and involved in the cognitive functions of the cerebellum. Usually when we talk about cerebellum, okay, ang ano nito, ang lagi nating sagot will be, it has something to do with coordination. Yes, correct. But it also has something to do with cognitive functions. And then, next, ano bang next natin? Okay, ito na yung spinocerebellum. So the spinocerebellum has something to do with, it has something to do with the integration of sensory input, okay, with motor commands to produce adaptive motor coordination. Okay, so the output, nasa gitna, ayan, spinocerebellum, in the vermis and in the intermediate portion. So the output is through your rubrospinal, vestibulospinal, and your reticulospinal tracts. Okay, and then, of course, we have our vestibulocerebellum. Okay, we have here the flocculonodular lobe and the vestibular nuclei. Of course, as we have said earlier, this has something to do with balance and equilibrium. Okay, so ayan. Okay, sasagutin natin to all together. O kaya, nasan yung aking chat box? Okay, sa chat box. Which of the following statements best describes a functional role for the intermediate zone of the cerebellum? Intermediate. Anong sagot natin? Intermediate. O, ayan, pinapakita ko na sa inyo to. Ang vermis, yung gitna, di ba? Sa tabi ng vermis, intermediate. And then doon sa gilid, yun yung lateral. Okay. A. A, ano ba yung A? Okay, controls and coordinates movements of the axial muscles as well as B. Ito na, sinagot ko na B. Okay, bakit B? Okay. Yung vermis, babalik ako ah. Okay, yung vermis yun yung nasa gitna eh. Nasa gitna. Okay. So that has something to do with the coordination of axial muscles na nasa gitna rin. And when you talk about the intermediate, okay, the intermediate portion, yung nasa gilid, Okay. So this has something to do now with the, intermediate. Okay, this has something to do with the distal muscles. Okay, the distal muscles. Yung mas gitna, yung vermis has something to do with the axial. Itong nasa gitna. Yung distal, yung intermediate has something to do with your distal muscles, and then the lateral. Okay, yung lateral, yun yung has something to do with the cognitive function and with the planning and timing of movements, because as the name implies, it has something to do with the cerebral cortex. Okay, so medyo mas higher yung function ng lateral. Okay, so the answer is letter B. Next. Yan. Sus ko, pag may nagkamali dito, no? What's the answer here? Chat box. Ito na ba mga sagot? Yan. Okay, may sumagot na sa akin. May sumagot na sa akin. May sumagot na ng mga tama. Okay. I'm glad. Ako, mababaw lang ako. Yan, puro tama yung sagot. Dapat naman. Okay? So the answer is letter B, cerebellum. Okay? But take a look at the question. I have underlined some terms. Okay? Dysmetria. Nasa assigned material to ha. Ataxia. Dysdiadochokinesia. Intention tremor. What are those? Okay, so these are all in the assigned reading. Okay, so ang sagot dito, of course, is the cerebellum. Yeah. Ay, yung blank na ganito, ibig sabihin tapos na tayo. It's because it's already 9:37. So again, salamat dun sa mga sumagot. Oo, tama mga sagot nyo. Okay, you made me happy. So, okay, I will not ask you if you have any questions. But as I said earlier, if you have any questions, you put your questions in the discussion board. Okay, put your questions in the discussion board. Pag walang nagtanong ng questions, PowerPoint, ito, o sige, okay. Hihingi nyo pa yung PowerPoint. Alam nyo, pagka hiningi nyo pa tong PowerPoint, dumadami yung aaralin nyo. If you notice in the asynchronous, I merged it with the reading material, because what happens usually is that you listen to the video, you study the asynchronous, And then magbabasa pa kayo ng iba na namang material. And usually, the reading material is what was discussed in the asynchronous. Kaya may nudge ko, parang hindi masyadong marami yung aaralin nyo. Limited na lang. So hindi ko dinadamot yung PowerPoint, bibigyan ko kayo. Pero if you get the PowerPoint and then aaralin nyo pa, nandun din ito dun sa, but I will give you. I'm just telling you. Ayan, ito na, may nagtanong na about lab manual. May I just ask po if we are to submit our lab manuals during this week's LabCon like last LE period? Okay. So we have our lab conference this week, diba? And then we will have our second lab conference for neuro next week. Diba? Next week nyo isasubmit. Next week, our submission of lab manuals will be after next week's lab conferences. So, paano nyo isasubmit? Kunyari, section A kayo. Okay, section A kayo. And then, nag-lab conference kayo ng Wednesday morning. So, you will submit your lab manuals right after your lab conference. Okay. So, kunyari, section B kayo. You had your conference, you will be having your conference on Monday. Pagkatapos ng lab conference, submit nyo na. Okay. But some of section C, announce ko na ngayon, some groups in section C will be having, I think 5 groups, will be having their lab conference Friday next week. Uy, pang next week itong sinasabi ko, huwag kayong malilito. Okay, Friday of next week. Okay. Kung kailan kayo nag-lab conference, doon nyo isasubmit yung lab manuals ninyo. Are there any other clarifications or questions? Baka merong hindi clear. Nag-thank you na sa akin yung nagtanong So, ibig sabihin naintindihan nyo. Any other questions about submission of lab manual? So, you'll be having a short break. Doktora Pamatmat?
Hi, ma'am. Sige, ma'am, kahit 10-minute break, so 9:50, we'll start the lecture on higher centers of the brain.
Okay, 9:50. May isa pang question. Doc, may assigned room na po for conferences. I will post it later. Doc, for the quiz next week po for section. Yes. Doc, for the quiz next week po for section A, Wednesday po ulit. Yes. Welcome. Break muna tayo. 9 minutes na lang. Kasi 9:41 na . You are welcome. Yung mga nag-thank you, you are welcome. Break muna. 9 minutes. Come back at 9:50.